Is your dog licking his paws excessively like this little bandit right here? This can be normal or abnormal. So I'm going to explain what might cause it and what you should or shouldn't do about it. In Benji's case, it's because I cheated. I smeared some peanut butter on his paw to get some B-roll. So if your dog is licking his paws, maybe it was actually me sneaking into your house and smearing some PB on your dog, meaning it's actually normal behavior. Normal for your dog, not so normal for me. I shouldn't sneak into strangers' houses when they are sleeping. But although this can be a normal behavior, if you are watching this video, then your dog is probably doing this excessively. There are two main categories for this behavior. The first is medical and the second is behavioral. If you want to know more about the medical, then check out this link in the description to learn more. In a nutshell, it can be a result of skin infections or inflammation, and it can also be a result of pain. For example, joint pain. So the first thing you should do is to go to your vet and have them diagnose it. A warning, it can sometimes take time to find the medical reason or to rule out a medical problem as a cause for the pain. It can also get expensive, so if there is a pet insurance available in your country, get it as soon as possible or become a vet. I'm Dr. Orion, a veterinarian and a veterinary behavior residency graduate. I became a vet to save money on my four-legged companions. It didn't work. To complicate things even more, sometimes the licking might start because of a medical reason, but will continue as a behavioral reason even after solving the original issue. Also, it might start as a behavioral issue, but the excessive licking can cause injury to the skin, which will make it even more itchy and painful. And we get the vicious cycle. Different kinds of anxiety might cause a dog to excessively lick. It can be due to being left alone, being stressed due to loud noises, being frustrated because they can't reach their favorite person, etc. It can sometimes be due to lack of exercise or enrichment, boredom. And it can be the result of compulsive behavior. In people, we will call it OCD, obsessive compulsive disorder. But don't really know what dogs are thinking, so we can't say they are obsessing. Okay, except for that dog. So in dogs, it will be called compulsive disorder. How to treat? Once we have a diagnosis, we need to treat both the behavioral and the medical at the same time. Because if one persists, then we can't break that vicious cycle. Sometimes an Elizabethan color, aka the cone of shame, is needed. If the dog is bored, then you need to find how to enrich his day. Some dogs need a lot of enrichment, like walks, toys, food puzzles, nose games, and some more walks. If your dog is frustrated or anxious, you need to find what is causing it and find how to avoid it. Also, you might be able to get the dog used to that trigger by counter-conditioning and desensitizing him to it. You better have a professional guiding you on how to do this, because it might be tricky, and if done wrong, might make things worse. If your dog has a compulsive disorder, and this is also true for some levels of anxiety, medications to reduce the anxiety might be required. What you should not do: do not punish your dog for doing this. It will only stress him out more and will cause it to worsen. Also, he might continue doing this behind your back. There are different products that have bitter taste which might deter your dog from licking. Most of the time they don't really work. But even if they do, they don't treat the cause for the behavior. Think about it this way. You have an itch and someone binds your hands so you can't scratch. Do you think it will make the itch go away and make you feel better? Or will you become even more distressed for not being able to scratch? If you want to learn more about clomicalm or clomipramine, a medication that is sometimes used for compulsive disorders, check out this video.